Medicaid creates policies and does not include the providers at any infancy stage of that. We kind of find out after the policy has already been created and they have these public hearings, and usually next day they roll them out. They've been proposing a policy to restrict mental health, and at first it wasn't even clear. The title of the policy change was not even addressing psychotherapy, but there were changes to psychotherapy included. What they're trying to do is put a restriction on mental health providers so that you have to get permission before you can actually see a client for therapy. First they asked for permission for all, but like you could never walk in, and just like you walk into your doctor, you can see your doctor, you couldn't do that with your therapist. So then they proposed 3 sessions. 3 sessions is still not enough, especially when it's combined with substance abuse and addiction. So if you're in let's say an alcohol or drug group, that's 1 session. Then you want to go talk to your therapist because you're depressed or you have anxiety, that's 2 sessions, You only have 1 more. Now the prior authorization process is a 7-page document, and it takes 5 days to get reviewed and get an answer.
I primarily see children and elderly people here in Las Vegas and Henderson who are all on fee-for-service Medicaid, and they've all been affected by recent changes to the Medicaid policy, which has reduced the amount of services that they normally get. And the kids that I see all have a trauma history or they have multiple mental health diagnoses, and they require a lot of services. And I'm here today to try to support them and support them receiving the help that they need.